All right, let's begin with the big story this evening, which continues to be the COVID-19 crisis, the second wave that we're in the grips of. Now, it's very early to say if we are seeing a downward trend, because that trend has to, frankly, hold for some time and continue to show that kind of plateauing. But on the face of it, at least as of today, the latest numbers show 3.66 lakh new daily cases in the last 24 hours. It's nothing to cheer about. But remember, we had reached way above 4 lakhs per day in the last few days. So we have seen a dip in the last 24 hours. The 7-day average is also showing a downward trend, but we have to wait and see if it continues. Meanwhile, even though we don't have a national lockdown policy at this point, so no national lockdown has been declared like last time around, but the fact is that across the country, every part of the country is in pretty much some kind of restriction. Now, some state governments are calling it a lockdown, some are calling it a partial lockdown, and some are calling it micro-containment zones. Before we start and get to our debates, let me take you across to my colleague Alex Matthew, who's breaking it all down for you and explaining how all of India is under some kind of restriction right now.
The second wave of the COVID-19 pandemic is yet to peak, but unlike the first wave, where the centre announced a full-fledged lockdown, it refrained from doing so this time around. Having said that, most states and union territories have some form of restrictions in place to curb the spread of infections. In fact, a number of them have just announced an extension of those restrictions. Before we look at those states, let's first take a look at the states that are most affected this time around. Now, while the second wave of the pandemic is far more pervasive than the first wave, in that a lot more states are getting affected this time around, the top 10 states continue to account for a large number of the daily additions. In fact, as of Sunday, the top 10 states are accounting for as many as 74% of the new cases, and within those, in particular, Maharashtra, Karnataka, Kerala and Tamil Nadu accounted for the most cases. And perhaps for this reason, a number of the states that have announced fresh restrictions or an extension of restrictions come within these 10 states. Karnataka has announced a full lockdown starting today and extending to the 24th of May. Tamil Nadu has announced a full lockdown that extends to the 24th of May. Kerala, just at the end of last week, announced an extension to the lockdown in the state to the 16th of May. Rajasthan will have a lockdown till the 24th. Maharashtra, remember, at the end of last month itself, had said that its lockdown would be extended to the 15th of this month. And in New Delhi, the government there just announced an extension of the lockdown till the 17th of May, and neighbouring Haryana and Uttar Pradesh will also have lockdowns, complete lockdowns, till that date. In fact, of the top 10, only West Bengal and Andhra Pradesh continue to have only partial lockdowns. Now, having said that, a lot of states are actually putting in place tougher restrictions. Punjab, for example, said that though it has a partial lockdown, its curbs are actually stricter than several other states. And really, the focus is now to achieve some semblance of order as we are yet to hit the peak in COVID-19 cases.
All right, now, if COVID-19 was not bad enough, if struggling for a hospital admission, then an oxygen cylinder, then medication in some cases was not bad enough, there is a new complication we all need to be aware of. It's called mucormycosis, aka black fungus. It is rare, but more and more cases have been seen in the last few months because of the COVID-19 treatment. And it is being taken seriously enough for the ICMR and the government to issue an advisory on it over the weekend. Now, before we get to detailing what exactly it is and how does one take care, how does one identify, etc., let me just play out for you this news report on what this black fungus really is. right, let's go across to Dr. Manish Munjal, ENT Surgeon at Sri Ganga Ram Hospital. I'm also going to be joined in a minute by Dr. Arvinder Soin, Chairman of Medanta Liver Institute. Dr. Munjal, great to have you on the show. Can you first just take us through what is this mucormycosis and why is it suddenly flaring up as a matter of concern in the context of COVID-19?
Yes, you see, the coronavirus pandemic that we are treating is basically based on two principles. And one is that the virus should be going out, which is almost like a natural course. And the second thing is the immune response that it stimulates in the body. If it is too much for the body to handle, you have to give immunosuppression for it. And for this, in the current scenario, the best treatment and the most widespread treatment is the use of corticosteroids, or commonly these tablets and injections like Medrol, methylprednisolone, and dexamethasone and all. They are wonder drugs and they are lifesaver drugs, which everybody has to use for moderate to severe cases. But immunosuppression also gives an opportunity to various kinds of bacteria and funguses which are not required to be invading the body under normal circumstances because of a good immune system. Now, whenever they get a chance, earlier we used to have cases of diabetes, of renal transplants, liver transplants, who used to get these infections once in a while. But now with so many COVID patients requiring immunosuppression, like a chemotherapy ward, a COVID treatment ward, and suddenly you have these opportunistic infections that come through the natural orifices like your mouth and nose. And if there's a mucosal breach or a slight ulcer somewhere, a slight breach, cut somewhere, they will enter through that area and go into the surrounding areas. For example, most commonly being this rhinocerebral mucormycosis, where the nose gets affected first, the infection goes into the surrounding tissues, then to the cheekbone, to the eye, causing blindness, and then even to the brain, where it can cause death, in certain circumstances. And unfortunately, this process is so fast sometimes that it hardly gives a chance for a unsuspecting patient or a treating clinician even to take action and go for it. But this is the fact. We have to be on the lookout, and we are trying our best in that.
So, Dr. Soin, I want to understand if these cases have been growing recently. And can it also be linked to the treatment protocol that we're using to deal with COVID-19 in the second wave? Doctors are finding that they might be more aggressive strains which require aggressive treatment. Is this mucormycosis, in a sense, a side effect of that?
Tamanna is clearly a side effect of the steroids that we've been using. So let me put it this way. The research around steroids being useful in moderate and severe disease happened somewhere around August, September last year. So perhaps so much of steroids was not being used in the cases in the first wave as we are using in the second wave. And of course, the total numbers of the second wave are 4 times higher. So you will see more of these cases. Physicians saw mucormycosis even last year, but not in such large numbers. Now, what actually are the reasons that it is happening now? It is not directly linked to the virulence of the strain. It is linked to the treatment that we give them, the fact that many of the patients have uncontrolled diabetes, the fact that many of them use steroids unnecessarily at home in higher doses than recommended, for longer periods than recommended. And there's a common practice, even among some doctors, that when patients are given high-dose steroids, and which means beyond 30, 40 milligrams of Visalone every day, they tend to carry this treatment on beyond a month or 6 weeks, trying to taper the patients off steroids slowly. Now, that is completely unnecessary. The patient gets much more steroid than they need. You need to give 10 or 15 days of steroids and then stop suddenly. No patient getting less than 3 weeks of steroids actually needs tapering doses later. So that's a misconception. So high dose of steroids, overuse of steroids, uncontrolled diabetes, unnecessary use of IV antibiotics, and unhygienic administration of oxygen therapy, especially at home and in smaller centers. When I say unhygienic oxygen therapy, I mean, the vessels and the water not being clean, the tubes, the masks, the concentrators not being clean. So they must be cleaned. And of course, poor orodental hygiene, or somebody has broken teeth or infected teeth, those also predispose to this kind of fungal infection. So when we know the causes that set them off, that sets off this infection, the prevention is relatively easy. So you have to prevent all these causes from happening.
Dr. Munjal, if you can give us some perspective of how much these cases have risen in the second wave or in the recent past, because clearly it's a problem which is large enough to have the ICMR put out an advisory. And that advisory is, in a sense, also, a message to doctors to not overuse steroids, etc. But have we seen these cases of mucormycosis or black fungus jumping a fair bit in the last few weeks?
Absolutely. I mean, as Dr. A.S. Soin, and what a wonderful person you have brought on the show, because he's one of the first people with whom, when in the back days, I've treated these mucor cases in liver transplant patients who were, one of those cases where immunosuppression used to be so common. So that was the thing that I was telling you, and we have treated them successfully with him. But now the situation is different. We are having normal people in which induced immunosuppression has been brought on a mass scale. And you can make that out by the amount of steroids that's disappearing from the chemist shops and all. H4 scheduled drug, which need not be given to anybody just like that. It requires a prescription and everything. And I totally agree that there's no choice in some cases. But, the way it's disappearing from the chemist shops, it's really fearful. And my mind is just thinking what will happen. Now, if we are thinking in this way, because of the severity, because of the cytokine storm, whatever is being done, the fact of the matter is that steroids are being given at a much larger pace. And because of that, we are not only seeing more amount of mucor cases coming in, we are also seeing them early in the course of the recuperation of the disease. For example, people are not even COVID negative, and we are seeing cases of mucormycosis, which was not during the first wave. And we've been talking to our colleagues, and they are equally sensitized to it. However, we have to work very hard on the detection now. The damage is already done in most of the situations in the second wave, and we are now on the lookout that we don't miss out on any cases and fit whoever requires therapy or who requires surgery, cleaning up, antifungal therapy we have to do, and do so perfectly so that they can do better in life. Because you get out from a well of COVID disease and you fall in a full ravine of this, and it's a big thing to have. It's expensive. People who will get into this situation, because the antifungal treatment for the start, it's called liposomal amphotericin. It's safer for the kidneys, that one we are using. The treatment is expensive, long, and it may involve longer hospitalization and surgeries as well if the life remains. That is the thing.
Dr. Soin, what can people watching this do? Obviously, clinicians now perhaps will be more careful with the kind of medication they prescribe. Chemists should not be selling schedule H drugs in any case, and people should not be self-medicating. But what can people watching this do to make sure that they don't find themselves in such a situation, or at least preemptive care? Is there anything that can be done?
So in addition to the earlier causes that are spelled out, which should be prevented, anyone who has diabetes should control their diabetes well. It will prevent them from having severe COVID disease, and also prevent this kind of fungal infection should they need treatment like steroids and other drugs that lower your immune system. So that's one. The second is that they should watch out for symptoms like headaches, facial pain, nasal congestion, pain around eyes, redness of eyes, even the teeth coming loose. These kind of symptoms may happen in patients who've recovered from COVID, come back home, But if they've had high-dose steroids for a long time, they should definitely watch out for these symptoms. And if they get any of these symptoms, then they should contact an ENT doctor or a neuro doctor or an eye doctor immediately.
And if I may add, sir and ma'am, the thing is that nasal hygiene, as sir said, is absolutely pertinent. One should make sure that if you are in a hospital or even in a homestay, nothing less than a perfect oral dental hygiene should be followed. For the nose, no special medication, but a simple hygienic saline wash can be a very good deterrent for the fungus to set in, because we were trying to prevent the mucosal breaks in the nasal mucosa. A healthy drop of almond oil or even paraffin oil is an excellent way to maintain the nasal mucosa from getting dry. So these are 2-3 things that one can do to maintain perfect hygiene, especially if you've been taking steroids and things like that. And of course, all the symptoms that he has told, like anything crusting in the nose, any weird symptom you find on the cheeks where there is a change in sensation, a pain, a lump coming in, or eyes starting to really pain or get red. These are the things that you should really look about. There's no perfect way of knowing it. But of course, if it is, you must visit. Simple nasal examination can show a lot of things if the disease is early, and we can take a small biopsy of that thing, send it to a microbiologist. As soon as it is done, you can start treatment immediately. So that is how it is treated, and sometimes you don't need anything more than just some injections and getting it okay. But if it goes delayed, then you are in for big trouble. That's for sure.
We don't intend to alarm viewers watching this, but the idea is to get medical experts and those who understand the science to explain to us what we can do to prevent, at least push the alarm bell when you need to, and know all of the alternatives that one can use. I hope no one really needs this advice, but the fact is we are seeing more and more cases of mucormycosis. It is a message for clinicians as well to perhaps temper the steroid use in the COVID-19 fight. Definitely a tricky balance to achieve. Thank you so much, Dr. Soin and Dr. Munjal, for taking out the time and speaking to us and hopefully helping all of our viewers.
It's a pleasure. Thank you.